Sokoto State, Governor Aminu Waziri Tambuwal. Many thanks for joining us, Your Excellency.
Thank you very much for having me.
Heard of some of the proactive steps by your state to ensure that COVID-19 doesn't spread into the state. Thankfully, you have a bit of time to plan. So, what plans are in place for welfare of citizens should the need arise?
Well, thank you very much. First and foremost, we thank God that in Sokoto State we have not recorded a single confirmed case yet, even though 15 suspected cases have been tested and returned negative. So we have constituted a multi-sectoral task force team that comprise all the stakeholders, health workers in the state for eventualities. And they have been very busy in sensitizing the communities. We have procured face masks, sanitizers, hand gloves, and we have engaged a number of organizations and NGOs that are sensitizing the public. We have in every local government emergency response teams that have been activated, and we have had high-level engagement with traditional rulers, religious leaders, under the leadership of His Eminence the Sultan of Sokoto for sensitization and mobilization. And of course, we have taken the proactive measure of closing the interstate routes into the state, into state borders, and screening points have been mounted. Before you come in, you'll be tested if for any reason you must be allowed into the state. And this is for the initial 14 days. By tomorrow, we are going to review the effectiveness of these measures and see what next steps to be taken. Of course, we have also embarked on a very massive training of health workers on how to handle patients of COVID-19 in the state. And of course, we have been tracking about 29 cases of returnees from abroad that came into the state before the order for the closure of interstate movement. We have also, in collaboration with Usman Danfodio University, as you have seen, established isolation centers both in Usman Danfodio University and, of course, the one that we have in Amanawa, the infectious disease hospital, where we are going to come up with about a 100-bed isolation center. And for the future, we're also working in ensuring that we come up with a 35-bed isolation center at the Murtala Mohammed Special Hospital in collaboration with the MSF, that is Medicines Francois. And also we are working on a makeshift 300-bed capacity isolation center in Amanawa, where we are providing tents for 3 segments of possible victims of this COVID-19, the young, the male and the female, the children, I mean the young and the female possible patients. And of course, we are working on palliatives.
Thank you, sir. You seem to be doing so much. Is there any other thing you would like us to know that you're doing in Sokoto to ensure that you do not record any case at all?
It has to be to do more with sensitization and mobilization of the public, and in collaboration, as I said, with all the stakeholders, religious leaders, traditional rulers, under the leadership of His Eminence the Sultan of Sokoto. And we're doing more of public awareness of the reality of COVID-19, that it does exist, and we must take all precautionary measures to ensure that it doesn't come into the state, and it doesn't, even if it comes in, it doesn't spread across the state.
Okay. All right. Thank you so much. Thank you so much, sir. The governor of Sokoto State there. And,
thank you very much.
In other news, over